folks, and everyone in Minnesota. This is Friday, April the 12th. Is also Convention Friday for some districts. So I know that we live here in on Lake Street, Lake and Bloomington. So we know that there's a convention this Saturday. Thank you so much if you're a delegate or if you're attending or if you're working um, in any campaign right now. This is thank you for your leadership. It's important to show up and talk to your neighbors, to other delegates about the issues that you care about. And that is precisely the theme why we're doing this live. It's precisely because of the issues that we care about. So, as you know, Unidos is a multiracial, multi-generational, statewide organization that builds power for social, racial, and economic justice. So, one of our most important campaigns is actually healthcare justice. We believe in a healthcare system that is a human right and that takes care of people, high quality, that is affordable, that doesn't discriminate folks based on income, immigration status, or race, that treats people equally, and that also doesn't take people to bankruptcy because they got sick. So we are very excited about this proposal that comes out of the work of the task force of the Minnesota Attorney General Keith Ellison. This is the Minnesota Debt Fairness Act. Look at the AG. There he is. Our Minnesota AG, the first Black Muslim man to hold a statewide office in the history of Minnesota. We're very proud of the work that the AG, the attorney of the people, has been doing in the state. So um, this is a very important bill for us. So basically, the Minnesota Debt Fairness Act um, looks at the problem, several problems in the healthcare system, and actually the healthcare debt in the state as is. So one problem is that medical debt is automatically transferred between married couples. And as a new American, I didn't know that until my husband got medical debt. So I just didn't, I did not think about that. I was not contemplating that I had to like figure that out sometime in my marriage or as I'm growing older and I'm thinking about possible retirement. We already have a hard time figuring older life as new Americans and people of color, and now I have to think about that, and I had no idea. So this proposal, thank you, Irving. This is Lake in Bloomington. It's very lively at this time. The solution that this bill proposes is to stop automatically transferring medical debt to a patient's spouse. No other debt can be transferred, so why medical debt has to transfer? So I'm like, this is very good for Minnesotans. The second thing that this bill does is it bans medical providers from refusing to care for someone with outstanding bills. As an organization that has a very vibrant and plural immigrant base, we know that this is a problem in working class and low wage communities. Care has been denied because people are unable to afford getting sick. This is crazy to me. As a first world country, one of the most powerful countries in the world, we are still banning healthcare because people cannot afford it. And I think this proposal, eliminate that through this proposal, is just incredibly important and incredibly um, it's life changing for many of our members, and this is why we're inviting you to take action, and you'll hear about it in a minute. The other thing this bill does is it bans medical debt from being reported to credit bureaus. Medical bills that someone did not plan for should not be able to ruin a lifetime of work building good credit. I love this, especially after COVID. For so many people that have long COVID, I know several families that have been trying to refinance their homes or get a new home or actually buying their first home or getting a good car, like a credit card loan. And medical debt continues to draw their credit score lower because of things that they have no control of. And they're being sanctioned for the inequality and all the things in the context of the life of Minnesotans that we don't have any control of. So I am very excited about this too. It also protects the last $4,000 in Minnesotans' bank account from debt collectors, so that debt collecting in healthcare doesn't have to just leave you in shambles and in total medical, in total bankruptcy, really. And the other thing is that creditors can garnish up to 25% of Minnesota wages. So this proposal uh, is proposing that base garnishment levels on income. People with incomes at around minimum wage cannot afford to have their wages garnished at the same level as others. So this bill will automatically adjust garnishments between 5% and 25% based on the person's income. I think this is a great idea. I am actually very excited that this task force brought these things together, is proposing this piece of legislation in this 2024, legislative session. And there is a chance to act. If you are affected, or if loved ones are affected, or you just care about providing a better playing field in terms of healthcare, and this Medical Debt Fairness Act is an opportunity for you to do that, please turn out, because the great news is that this is a proposal. It has authors. In the Senate, the author is Senator Liz Bolden, and I'll tell you who the House author is in a minute. But in the meantime, let's put in the flyer about the rally for medical debt fairness this Monday, April 15th, at the Minnesota State Capitol at 1:30. We encourage you to be there a little bit before 1:30, probably between 1:15 or so you can park. You remember that the Capitol complex is a big it's a big complex. There's a little bit of walking. So please plan accordingly to join us at 1:30 at the Capitol Rotunda. We are very excited that this bill has been introduced, or is going to be introduced if it hasn't. This is a very important solution for our community, and this is an opportunity for all of us to show up together. The weather is beautiful. This is a great bill. This is a great proposal, and we invite you to join us on April 15th at 1:30 at the Capitol Rotunda for the Debt Fairness Act rally, and then talk to your legislator, to representative, your senator, to remind them that this is an important proposal. The author in the House is Representative Liz Rayer, and the senator, the chief author in the Senate, is Senator Liz Bolden. So if you're representative, if Liz Bolden is your senator, send her a thank you. Let her know that this is important for you, and thank her for doing this work. If your representative is Representative Liz Rayer, the same. This is an important and courageous next step towards building a Minnesota that builds a Minnesota that is represented by a multiracial democracy that does not leave anybody behind. And that is not just representation. It means a fair chance at prosperity, at an healthy economy where things like getting sick do not have to break the bank, do not have to destroy families, do not have to leave you to be in or have you live in the choices between paying your rent or paying your mortgage or paying your debt, your medical debt, something that we have very little control of. So please show up. This will be a bilingual rally. We will have interpreters as well. And let us know. Send us a message if you want to hear more about this rally. Let us know. We will post some materials in our social media. We're very excited about this bill. And if you have questions, let us know. Thank you so much. Have a great rest of your weekend. It's Friday and everybody knows it. Rest up, regenerate, have a happy and joyous and abundant democracy weekend for convention if your district has a convention right now. And we'll see you on Monday. Thank you so much and have a great weekend.